Hello and welcome. My name is Saad Dinno, pharmacist and co-owner of Acton Pharmacy, West Concord Pharmacy, and Keys Drug and Newton. I would like to welcome everyone back to our show, A Healthier You, where we would discuss current health topics and provide information that will guide you to a healthier lifestyle. Today, we'll be discussing some of the important community health services that the Town of Acton provides for the residents, as well as medication safety. To discuss these topics with me today, welcome back Heather York, a registered nurse and administrator of the Acton Nursing Service. Thank you for being here today, Heather. I appreciate it. I'm so pleased to once again to have you on our show to educate our viewers about the important services and tools available in the community. Can you please tell us a little about yourself and your professional background?
Oh, sure. Thanks, Saad, for having me again.
My pleasure.
So I'm Heather York, as you said. I'm a registered nurse. I work for the Town of Acton. I'm the director of the Acton Nursing Services, which is a twofold agency. One is we do the public health for the Town of Acton, as well as we are a visiting nursing service. So we do home care.
Okay, thank you so much. And where are you guys located?
We're located at the new Human Services and Senior Center building at 30 Sudbury Road.
Awesome, a beautiful building.
It's gorgeous.
I remember the closet that you guys were in, to a beautiful facility now.
Definitely, much needed space.
Congratulations.
Thank you.
I know that you guys serve, obviously, Town of Acton, but you also surround the surrounding towns. Which towns do you serve and what do you offer them?
Sure. So for the Town of Acton, we do the public health as well as the VNA visiting nursing services. Okay. The other towns that we cover are the adjoining towns, okay. Stowe, Carlisle, Concord, Littleton, and Boxborough. Okay. So for those, we provide our home health services. So we do visiting nursing services in those towns also.
Okay. And what kind of services are those, if we could discuss
sure.
those?
So our home health agency has nursing staff, physical okay. therapy, occupational therapy, speech therapy, and home health aides for help with ADLs.
Wow, it's a lot of services.
It is.
So Heather, let's talk about public health, because that's the agency that you guys mm-hmm. have in town. Can you elaborate on the community health services that your agency provides mm-hmm. and the various clinics that you've held, that you hold during the year?
Sure. As the public health department, we're required to do disease surveillance through the state. We work with the Department of Public Health. So anyone in Acton who has a communicable disease, we do follow-up on throughout the year. Okay. So that's one of our most busy pieces of the public health. We also do the Vaccine for Children program through the state of Massachusetts. Okay. So we provide vaccines to the uninsured and underinsured children. So typically we see a lot of the kids coming into the community from other countries who have not had their basic vaccines coming into the school system. Okay. So there's a lot of work between us and the school nurses, which is great. The other things we do is we offer an impact testing program, a baseline testing. Impact is a cognitive testing system that is used by neurologists, especially after a head injury. So we've been working with the high school and done the incoming freshmen okay. through Acton Boxborough. Yeah. We do that baseline testing, so if in the future there is a head injury, we can help the doctor by doing the retest, the post-concussion testing okay. In town, and get that over to the doctor. So that's been working really well.
And when you say head injuries, we're talking specifically about concussions?
About concussions specifically, okay. yes. There's quite a bit at the high school level, not just sport related. There's other things, just car accidents, whether it's an accident, with kids fooling around and they fall and they hit their head, horseback riding, dancing. So there's a lot of different pieces to that.
So every freshman that goes into the high school is getting that baseline testing.
Correct.
Incredible.
Yep.
That's awesome.
Yep.
Which is helpful for the future if, God forbid, they get a
Exactly,
concussion.
yeah.
Baseline for
Impact is a baseline that a lot of the colleges and sports teams are using now, the NFL, the NHL, so it's a really good tool to give doctors a picture of what a child or an adult looks like cognitively, and then after a head injury, how they compare to what they were post-concussion.
And how often are those compared? I mean, I know the answer to that, but just for our
Sure.
audience.
So for on the high school level, the recommendation is to do them freshman and junior year.
Okay.
So this year we're transitioning to hopefully do both ages. So our first year that we did it, we did freshmen alone.
Okay.
Those freshmen will be turning juniors. So the level of their cognition and how their brain functions in that 2-year period does change a lot.
Okay.
So it's always good to have that updated within a couple of years. Most of the colleges, if you're on a sports team, do require that also as incoming freshmen.
Correct.
So then again, within 2 years, they'll be having another test, most likely, especially the sport kids.
Is this a free of charge to the
It
to the
is.
kids?
It is free of charge.
Incredible.
We do
That's
it
nice.
as a public health service.
Awesome, awesome.
Yeah.
So let's focus on public health for a second.
Sure.
Can you elaborate on the community health services that your agency provides, in the sense of, I know you guys do, we just discussed this, about concussion and stuff, but you also guys do flu clinics and
Right.
other vaccinations that you kind of honed in on a little
Right. We also do flu clinics with our staff every year.
Okay.
We typically do about 6. We do 3 at the high school, big clinics for the entire town, and then we do some at our new building, which the space has really provided a good spot to do that.
bit. Roughly how many vaccinations? Flu vaccines do you
This
guys
year,
do?
I think we did just about 945,
Incredible.
somewhere in
Incredible.
that range.
That's
yeah.
awesome. And
So
it's kids to adults.
6 months and above.
Awesome.
Yep.
Awesome. 2 follow-ups to that, Heather. How important is home health care to your agency? And what does this normally entail?
Sure. So home health for us is very important. We see a lot of seniors in the community most often who are at risk within the community, who don't have family around, who will go into a hospital or a rehab facility or just have something in general going on that a doctor wants another set of eyes on. So we go in and we follow doctor's orders and monitor the patient while they're home. You have to be homebound to be under home care. That's one of the regulations. So folks are usually at home. There's a lot of folks that aren't driving at that point or can't drive. So they really need another set of eyes. So for us, that's really an important piece.
And what's the definition of homebound? I mean, I understand no driving, no.
Sure. So technically, the Medicare regulation is that it is a taxing effort for you to get out of the home, meaning that you have to have the assistance of another person and usually it's an assistive device.
Such as a walker or.
Such as a
cane
walker or a
crutches.
cane or a wheelchair.
Okay. Thank you for that. What are the greatest challenges facing communities like Acton in terms of access to care?
I think for Acton, the biggest bump in the road is that there are doctors in Acton and Concord, obviously, with Emerson Hospital and the groups over there, but we find a lot of folks head into Boston to the Boston hospitals, and the biggest problem is transportation, is getting to those Boston hospitals. The town has Crosstown Connect and their door-to-door service with the van in town, the transportation services, which is wonderful. Unfortunately, it doesn't go past certain towns. So to get into Concord or to get into Maynard, things like that, it's very useful. But beyond that, for a lot of our clients, we see them going into Boston, going to the Bedford VA even, and there's a challenge of how do we get there?
And does the town of Acton, besides, I know we discussed in the last program with Sharon from the COA here, the van you discussed, are there other assistance that our audience could utilize if they are seeing people in Boston?
There is the ride. It can be a challenge sometimes to get that scheduled because it is so busy and it is limited. There are taxi services. I know that the senior center does have some contacts that will do a ride in their car as an outreach to the town. That can be utilized, and if you're looking for information, Beverly Hutchings at the Council on Aging is the person that does the outreach for the senior community.
And we'll try to put her name at the end of the credit so our audience has her information. What types of wellness programs does Acton Nursing Service provide? We hit on a couple, but I think you guys do more than that.
Sure, yeah. So our wellness, as we said, we do the flu clinics and the vaccines. We also do a blood pressure clinic twice a month. Linda Cullen, our public health nurse, who you know, Saad.
She's awesome.
Yeah, she's great. She does a wellness hour. It's actually 2 hours, so we should rename it. But she also does wellness discussions once a month in our office. Last month was about Lyme disease.
Awesome.
Next month, I believe, maybe next month's Lyme disease. But she does our wellness discussions. Some other things we're doing now that we're in our new building and we have a shared space with the other human services department, including the COA. We've done some nutrition programs with a registered dietitian for the seniors, and we're also working on a program for senior garden therapy. So it's horticultural therapy at the senior center. So it's working with plants to help relax, focus, reach a goal. So it's a nice program, and we're just trying to do more things like that. We've also done a couple of Red Cross blood drives at the space, you know, which is great too.
And where can people find out information about these wellness programs?
So our wellness program information's on our website. So it's www.actonnursingservices.com, or you can go to the town website and you can access it through there.
Awesome. So on our show, Healthier You, we're focused on educating our viewers about healthcare, and big part of it is medication safety. So what do you think is most important to keep in mind when discussing medication safety, in particular with elders who are often using multiple medications? And I know, I have had several discussions about this and have collaborated on with certain clients and residents in town. So can you just discuss what you guys do?
Sure.
For
So
that
as a public health department and as a visiting nursing service, our focus when we go into someone's home to talk about their medications is to make sure that they have the right med, the right dose, and that they have a list that tells them exactly what they're on, or in case of an emergency, if that list is needed by a 911 person coming into the home, that there is an updated list. So we really make sure that folks have what they need and that there is a list within the home. That's really important. The other thing is really to talk to your doctor and to someone like you, Saad, the pharmacist, about side effects, any interactions that might be going on with the medications that they're on. When we go in, we do assess that and make sure there's no big interactions that jump out at us. So there's a lot of communication between us and the doctor's office.
And when you say we, who are you referring to?
Our nurses.
Okay, so they're all nurses, all RNs. Okay. And if that list you talked about, and to me, that's the most important aspect for an individual to have, is an up-to-date list of medications they're taking. Because, again, if they end up in emergency room and they're not conscious and such, that piece of paper says a lot. So do you guys provide anything for seniors or other residents in town?
We do. We provide similar to the File of Life. It's a packet that is magnetic. It sticks to your refrigerator. It's bright red, and in it has a list of your medications. It has what kind of diseases you have, whether you have a cardiovascular disease, diabetes, etc. Has your emergency contacts, has your doctor's information. So has all of those pieces that if emergency responders come into the home, that might be something that they'll need, and they can take it right off the refrigerator and take it with them. There's also wallet ones that people can keep in their wallet, so it's good to have that on you, whether you're in your home or you're away. It's always good to have that updated list.
Again, whether it's Life of, you know, what is that called, the red one?
File of Life.
File of Life, or the other ones that you guys provide.
Yeah.
I know personally that from customers that has saved their lives because everything was on that packet.
Right.
So there was no questions asked. You know, they went to the ER and there was medications were able to be provided when they were in the hospital.
Right, exactly.
You know, and also the fire departments and the police departments and the EMTs, they know to look for that right away.
And they do.
And they
right.
do. So
they always ask for that.
Absolutely, absolutely. And then, you know, I know majority of your patients or customers, if I may call them that you take care of, the residents, are seniors, and you know, some of them may have disabilities. Medication safety is even more crucial, you know, to them. Again, any extra help that you guys provide those individuals?
Sure. So
when it comes to medications?
So when we see someone who has, whether it's a cognitive issue or they live alone and can't manage their medications on their own, we have provided services where we will fill a MediPlanner for them and do some teaching on that.
Okay.
But as you and I have discussed many a time, and we've worked together, your medication on time program at Acton Pharmacy is really helpful for folks. It just keeps everything in one place and up to date.
So, can you discuss your MediPlanners a little bit? And I'll discuss them, you know.
Oh, sure.
And then we can have a discussion about medicine on time.
Right. We hand out MediPlanners to our patients and anyone who stops into the office if they're looking for one. They come in a pack of once a day pills that you might take. They also come in twice a day and 4 times a day.
Awesome.
So what we do is go by that record, that list that they have, the list that the doctor's given us or the hospital may have given us when someone's discharged, and we help them and do the teaching, make sure they have that updated list if it's changed, go through filling it with them, watch and make sure they can fill it successfully themselves, and if there is issues, something like your medication on time where the pharmacy is doing it and the client doesn't have to worry about a thing, they know that as things are updated, the doctor's calling you, it's getting changed and redelivered. So those things are really helpful.
And you know, your agency and our pharmacy have collaborated on that aspects and have assisted many residents when it comes to that medication. And what, you know, Heather, what you're referring to is a system called Medicine on Time that we have here, and basically it's based on the, you know, whenever you take your pills, whether it's in the morning, it's going to be in a yellow. If it's in the afternoon, early afternoon, it's going to be in a white package. If it's, you know, late afternoon, it's orange, and then if it's at night, blue, dark. So it's in a dark blue package. And we basically, as you said, we manage the medication from A to Z. We work very closely with practitioners, whether it's physicians, nurse practitioners, your office, visiting nurses, home health care agencies, to ensure that the person that's utilizing this service is up to date on their medications. We handle changes, we go send our drivers, they pick up their medications, bring it back, and we've had a good collaboration on that. And you know, we could tell great stories of people that have stayed out of the hospital because they were able to be compliant with the medication based on this system and the system that you guys provide. So it's important, it's available, you know, to anybody.
Right.
Obviously the system started for people that were in assisted living facilities, but we've expanded over the years and we have several hundred people on this service right now, and it's an incredible thing. I know what you guys do as well is incredible, because one of the costliest aspects to our healthcare system is non-compliance with medications.
Right.
And we're talking about billions and billions of dollars. And you know, if a system like this, you know, that we provide or services that you provide increases compliance, then it's an overall much better picture for our healthcare, and ultimately better compliance equals better health.
Right. Right.
So you know,
and when you manage someone's Coumadin or warfarin, as you do, and delivering that and, you know, changing it and coming to get it, pick it up and change the dosing for the doctor's office, I mean, that's just the best service.
Thank you.
You feel safer having people do that.
And you know, I have a great pharmacist that does this. You know, the whole team that he has behind him, Jeff, and you know, he's very passionate about it, and you know, ensures that, because we know we're managing it, so they have to get the right medications.
Right.
I mean, you know, so
Yeah,
it's
Jeff is great.
Thank you.
Working with the seniors
you
is
know,
just really great.
It's been a great service that we provide, as well as what you guys provide and other home health care agencies. It's been incredible. So, again, better compliance, better health. So make
Exactly.
sure that you keep up with your
Safety.
medications. Safety is important. Let's change the subject now as summer's approached. It's getting warmer out there. How do you work with residents to ensure that they stay safe in the summer months?
So we do some of our wellness discussions do focus around staying cool and staying hydrated in the summer.
Okay.
It's very important for seniors to stay hydrated. And in the summer months, it's even harder because the change, just a subtle change in temperature for a senior really can do havoc on their fluid level.
Okay.
Both is dehydrating, but sometimes overhydrating.
Correct.
You know, it's different for every senior. So that's one of the programs that we do typically touch on.
Okay. And, you know, another important aspect is, you know, you hit on hydration and, you know, make sure that we don't get dehydrated. We sweat more in the summer. We lose, you know, there could be, you know, somebody has blood pressure, the salt imbalance could cause havoc. So we have to ensure that we have, you know, enough fluid intake. But as well, diet is important during the summer. Can you discuss that, and what do you guys teach residents?
Diet's very important in the summer.
Yeah.
You know, one of the things that we try to teach folks is to have things pre-made.
Yep.
So you're not turning your oven on and heating your house up every single day, because that will really cause some serious dehydration for folks. A lot of seniors don't use air condition, so it's good to do things ahead of time, or do things that are cool, that are a little less heavy on the stomach in the summertime, but focusing on eating things that have a high water content. Cucumbers, watermelon, peppers all have high water contents. Any kind of fruits, berries, things like that. You get the hydration that you need, but also you're getting good nutrition. And then doing lighter meals, you know, even just having, you know, some cool chicken salad, or some hard-boiled eggs, things like that that are lighter on the stomach, but making sure that you're getting everything that you need, all the nutrients that you need, including salt, some salt. Even if you have an issue with salt, having some salt in your system and potassium in your system helps you from getting dehydrated.
Anything else you'd like to add about what Acton Public Service does for the town, or any other services coming up that you want to mention before I do my conclusion?
I don't think so. I think we're pretty up to date right now.
Thank you so much, Heather.
Sure,
thank you so much. Thank you for taking the time to speak with us today about the array of services that your department provides, as well as medication safety and the tools available to our residents. Please let our audience know how they could touch base with you one more time if they're interested in reaching out to you.
Sure. We are at the Acton Human Services and Senior Center building, 30 Sudbury Road.
Okay.
We also have a website, www.actonnursingservices.com, and our direct phone to our office is 978-929-6650.
And if you haven't visited the building, please do. It's an incredible building.
Right.
Thank you
Please
again.
stop by.
Thank you so much. Thank you for tuning into our Healthier You episode today. I'm Saad Dinno, co-owner of Acton Pharmacy, West Concord Pharmacy, and Keys Drug and Newton, and I look forward to seeing you around town. Be well.